Come feel my life from the inside, Lord, from the inside of me. Set me on fire, yeah, from the inside, from the inside. Oh, 'cause all I want is for you, you to be glorified, for you to be lifted high. All I want is for you, you to be glorified, you to be lifted high.
Let praises rise
From the inside, from the inside, Lord. Come on, tell him this morning. May you delight in the inside, God, in the inside, Lord. Come fill our lives this morning, Lord, like only you can do, Jesus. On the inside, on the inside, Lord. Set me on fire, yeah, on the inside, on the inside, on the inside. All I want is for you, you to be
glorified, for you to be lifted.
all I want, God, is for you, you to be
glorified,
yes, yes.
for you to be lifted.
All I want, God, yeah, is for you, you to be lifted high, God, you to be glorified. All I want, dear Jesus, is for you to be. Hallelujah. Come on, everybody, sing that with us. All I want, God, feel me, Jesus, you to be more of you, less of me. All I want, King Jesus, is for you, you to be. Can we do it just one more time, please? All I want, King Jesus, hey, it's for you, you to be glorified. Come on, how many of you know it's all about him? It's not about us. All I want, King Jesus, hallelujah, you to be. Come on, I believe one person needs to sing it again. All I want, King Jesus, more of you, hey, less of me, yeah, more of you, and less of rain, more of you, Jesus, less of me, God, you to be. Feel my life till all they see is you, Lord. Glorify your name. Feel my life till all they see, God, is you, Lord.
And welcome to another episode of Wellness Wednesday. My name is Christy Arnold, and I am the Health and Wellness Director here at Word Tabernacle Church. Today, we have a very special guest, Dr. Kenneth Moore, emergency room physician from Nash UNC Hospital. Dr. Moore is here to just enlighten us and bring us lots of information so that we can be more knowledgeable about COVID-19 and the vaccine. Dr. Moore graduated with a Bachelor's of Science degree in biology from Georgetown University. He received his Doctor of Medicine from Washington University School of Medicine, and he also holds a Master's of Science in Clinical Leadership from Duke University School of Medicine. He did his postgraduate intern training and residency combined with internal medicine and pediatrics at Albert Einstein Medical Center in Philadelphia, Pennsylvania. His specialty certifications include Board Certified Emergency Medicine, Fellow American Academy of Pediatrics, American Board of Pediatrics, American Board of Internal Medicine, and National Board of Medical Providers. Dr. Moore has held numerous positions since he started his career as a physician and medical director, but he currently is the chairman at Nash UNC Healthcare Department of Emergency Medicine and the attending physician for Wake Emergency Physicians and Nash Healthcare Systems Emergency Department right here in Rocky Mount. Now I'm going to turn the mic over to Dr. Moore so that I can ask him, what else do you want to add, Dr. Moore?
Well, Christy, thank you very much for that introduction. The only thing I'd add to that, and that is fairly extensive, but something I'm very, very proud of, is the fact that I am the medical director for Nash EMS as well as Halifax and Northampton EMS services. I'm very proud of that fact. I work very hard with my technicians in delivering a service to the community through that.
Yes. Thank you, Dr. Moore. Thank you
You're
for
welcome.
being here with us. Thank you for this
This is very, very
episode.
necessary, and I'm glad to be invited to be here with you.
Yes. Well, let's move forward with our questions. So the very first question is, from a medical provider's perspective, please share your thoughts on where we are and where we're moving as a society now that we're opening back up post COVID-19, after the COVID-19 pandemic.
That's a great question, and that's a very broad question.
It is.
And we can drill down on a number of areas with that. But as an emergency physician and just as an American, one of the things that I'm glad to see is that I can actually now start to see the light at the end of the tunnel. For a while, and, as you know, when the pandemic first started, there were more questions than answers. There were more insecurities than there were reassurances. And the fact that this is something that we had not encountered in the United States before. And being a physician, that was particularly disturbing because we were actually looking at trials. We were looking at what therapeutic options we could offer people, what had sound medical background and rationale for use versus what was more hearsay. And as you know, that there were a lot of things that were in tabloid press, that a lot of things that were in social media that actually were never actually found to have a basis in fact and actually were harmful to people. So the good thing is that fast forwarding through that year, we saw that we were actually able to mobilize. We were able to be more efficient, effective, communicate, and look at what's going on not only in North Carolina, but also in the United States and also around the world, because everyone was getting together to try and figure out, how do we beat this? How do we get to a state where we can reopen? With the background of that, we were also seeing, unfortunately, the climbing death toll. As we were going from 1,000 to 10,000 to 100,000 to where we are now, there's over 600,000 souls. That's very sobering. And it's very, very sad with that. So one thing that I can say is that over this year now that we've been going through this, we can actually see that we're making progress as long as people remember, number one, the basics, which has helped most of us to get to this point,
Yes.
which is social distancing,
Yes.
wearing a mask,
Yes.
washing your hands, the simple things mean so much. But now with the advent of another tool in our arsenal, another weapon in our arsenal, which is the vaccine,
Yes.
that has opened things up even more. And so, as I said before, I'm glad to be here with you today so that we can really explore how that can help us to reestablish a new norm moving forward.
So yes, Dr. Moore, thank you for that. I'm glad you mentioned the vaccine, and we will actually talk about the vaccine a little later on in our interview. And by the way, our interview questions were gathered or put together by you, Word congregants and people from the community. I did a survey, and you brought me these questions that I have put together to ask Dr. Moore. So I want to thank you, viewers, for what you did. Our next question, Dr. Moore. So with the 196 deaths that we've had here in Nash County, how do you recommend that families cope with the death of a loved one who was COVID positive that did not get that opportunity to visit them prior to the death?
That's a very deep and insightful question, and one that everyone has wrestled over. The issues are from the time that loved one actually enters into the medical system. They are actually starting the quarantining process. So whether they're picked up by first responders or EMS and brought to the hospital, to the emergency department where I work, there are restrictions in place so that we can minimize spread at that point.
Minimize spread.
Exactly. And we have tried over time to work not only at Nash Hospital, but also we found nationwide that people have implemented using technology, FaceTiming, so they can at least stay in contact with their loved one during the time. Nothing really replaces the intimacy and the importance of human touch, but at least they have a chance to talk or see that person. Now, in the unfortunate circumstances where someone has died, we have a grieving process that has to start. And one of the hard issues about grieving, when you're not able to see the person or touch the person, and you haven't been around the person for weeks, well, days, weeks, or months, depending on the length of the disease, that makes it even more difficult.
It really does.
To do it in a healthful way. And so personally, what I have found that's been helpful is really taking advantage of a lot of the mobile platforms that we have. Google Meet, not to necessarily endorse one over the other because
That's
they're all
correct.
fine, but to make use of those things, to have group meetings with family members where they can actually share stories, where they can get together and talk about it, and talk about their feelings. That is helpful. Now, what I also see is that, one, as we're starting to emerge from the pandemic and starting to see, as I had said before, the light at the end of the tunnel, we are now able to recommend, as Governor Cooper has endorsed, actually gatherings, okay, as long as, again, they make sense with masking, distancing, hand washing. If they're outdoors, even better, and then with vaccinations, that makes it even more important and actually starts to also help the healing process. But as a corollary to what you've talked about, or what the question presents, is the issue of dealing with anxiety and depression that a lot of family members have with the fact that they haven't been able to see the loved one, or if they feel, for whatever reason, that they might have contributed to that person contracting the disease. Being real about it, that happens.
It does. It really does.
And so making sure that we provide access to mental health resources, or
Yes.
encouraging people to follow up with their primary care providers for that, and to let them know it is okay to feel depressed. It's okay to feel anxious. We're at a point that a lot of people have never encountered. We're a very social society, obviously. That's kind of redundant, but the idea is that we thrive on meeting with one another, going out to a movie, to have drinks, or just holding hands, walking, talking, being close. And when those are taken away, it actually changes how people develop and how they learn to cope with death. And also with kids. We also notice that that's changed how they've socialized since they've actually been remote learning for a while.
Yes.
So.
Well, thank you for that one. Another question I have, I am a registered nurse, so we all hear, from the nurse's point of view, how some of us get burned out with taking care of COVID patients, but no one said anything about providers. How do, from your point of view, your personal point of view, how do you feel about taking care of the numerous COVID-19 patients that you have seen in your emergency room? How does that make you feel emotionally?
Well, that is that's a very good question. It's not difficult to answer, but it's tough to wrap my head around because one of the issues is we get burned out too. Because one of the things that we try and do, particularly as emergency physicians, is to be very empathetic towards our patients, but to be very efficient and expedient about their care.
Yes.
So that we have to maintain some clinical distance to make sure that we can see the whole picture, be able to make decisions quickly and effectively. And so it's very difficult. At the height of the pandemic, when we were seeing several cases per day, it was actually wearing on a number of us, myself included. And I will admit, because a lot of us, after we finished work, we still had to maintain because of the exposures that we had to maintain our distance from family members.
Yes.
So almost imposing our own self-quarantine. Now, I have lost a couple of physician friends to COVID over this past year who were very close, but, at least I tell myself, there will be a time when I'll be allowed to actually grieve and to take a deep breath. Because sometimes you have to exhale. So yeah, it's something that also through my organization we have health and wellness outreach that we can all take advantage of. And one of the things that they've actually stressed is even during a shift, because in emergency medicine, we work shifts, is to be able to take time to have a cup of coffee, sit down, take off your mask when you're by yourself, take a deep breath, play some music, even if it's for just 5 minutes to decompress, and then get back out. And that actually makes a difference.
It really
time.
does.
So,
it really does. So some self-care is what
self-care,
it's
exactly.
Self-care is what we all need, self-care.
Yeah, to keep from getting burned out.
Yes. Thank you for that. Yeah. So we all know how important the COVID vaccine is and why we need it, but explain to some of our viewers, how do they create the vaccine so fast, and how do we know it's effective?
Well, first, let me this was an interesting confluence of a lot of factors that helped us to generate the vaccine and what people perceive as being very, very fast. Now, getting more of a historical perspective, we know that vaccines, back in the 20th century, actually used to take several years to develop. Even from back in the 1800s when Jenner first did smallpox vaccine, it wasn't widely accepted. Now, one of the things that we've also had as we move from the 20th to the 21st century is the advent of a lot of new technologies in terms of computer processing speed, the ability to map the human genome and other genomes, which has also been very helpful, and the test exposures to SARS, severe acute respiratory syndrome, and MERS, the Middle Eastern respiratory syndrome, which are almost cousins to what we've dealt with in the COVID-19 virus. Now, interestingly, coronavirus has been around forever. You know, I remember back in medical school, and I'm not going to date myself, but back in the 80s, I remember studying the coronavirus and getting an idea of what it causes, you know, mainly the upper respiratory, you know, the sniffles, the sneezes, the cough, you know, low-grade fever, not too bad, but people usually get over it. But then as we fast forward to 2002, 2003 or so, that's when the rest of the world was dealing with SARS. It really didn't hit the United States. However, fortunately, the infectious disease experts, as well as our scientific community, took notice of that. And they actually started working on identifying the structure and the function of different parts of the coronavirus that caused this infection. So we were starting to get leads into it and identifying what the working strategy is for that virus and how it infects people back in 2002. So along with this, and as we move forward, you know, they like to trace the start of the SARS-CoV-2 or the coronavirus 19 to Hunan, China, back in 2019, December or so of 2019, when they first saw some reported cases. There is a group, it's more of a global initiative, scientific community, that usually maps the genome of influenza each year. Well, they looked at, this time, COVID. And so they dissected it and figured out, well, this is what makes this virus work. This is how the structure is on this virus. They shared that with the world. Okay. And that was at the beginning of last year, 2019 to 2020, that we got that information. Now, forwarding from that, all the work that had been done now started culminating. Well, the roadblocks to actually developing vaccines include a lot of politics. I am not a politician. Don't pretend to be a politician. But I know how it can slow things up. Now, there are ways to make things more expedient, and that's the way I look at things.
That's right.
Black and white. I know there's shades of gray in between, but one is actually releasing the funding, so that people, scientists, can get paid, and they can pay researchers and fellows to move forward with this, to make it advantageous. Also for pharmaceutical companies, the same. So with that, with Operation Warp Speed, things were actually opened up, and so they were able to move forward with it, and actually, and this is globally now. This is in cooperation with what's going on in other countries, what they're identifying, what they're seeing with their populations who are being tested with different vaccines and different vaccine
So we have hundreds and hundreds of scientists working together.
Exactly.
Not just one person, not just one nation. We have many nations working together. Yes.
Exactly.
Yes.
Through the World Health Organization. And that's the whole idea of global cooperation.
Yes.
Because it helped to move things forward really very, very fast.
Very fast.
And we were able to enroll people in all the various phases. I know people have heard on TV when they talk about phase 1 trials, phase 2, phase 3, et cetera. But the whole idea is that a lot of these trials, you know, the first one just looks at, is it safe?
Right.
The second one looks at, well, given this immunization, does it actually help the body to generate an immune response, or what's called immunogenicity? The third phase is, okay, does it apply to a large population? Is this going to work? And can we adjust the doses? What's the best dose for it? That type of thing. So all these trials, instead of going sequentially, finishing one and then starting the next, they actually went in parallel.
That's
because
interesting.
There are other places that are looking at the same things too. Now, in the United States, we really looked at Pfizer and Moderna as the two vaccines that were being developed. You know, Johnson & Johnson was also moving along very quickly. But fortunately, they were able to get their information, and they were keeping it transparent to everyone so they could see what they were doing all along.
Gotcha.
So to answer your question, that's a long answer to a short question, but a very deep question.
It was very detailed and a very good answer.
Exactly. So the idea, it wasn't that fast.
Thank you for that. You really broke it down for us, because a lot of the stuff I had not heard before, and I've thought I was very knowledgeable on it, but wow, thank you so much for
not
that.
a problem. No.
Let's see. So many people, you know, we do the vaccine clinics here at Word every Tuesday.
Awesome.
Many African Americans are still reluctant, you know, in receiving the vaccine. How is vaccine hesitancy being addressed by medical providers? What are y'all doing?
Very good question. Yeah, it depends on who you're asking. Yeah, I think the most general response is we're trying to make sure that we give accurate information.
That's very
And that we're
important.
trying to make sure that we are available should people have questions about it.
Yes.
Now, I can't speak for everyone, okay, but I can say that at least in my practice, one of the things I like to do is to make sure that I'm a reliable information source, which sometimes means that I may say, I don't know, okay, because we're still finding out information. This, again, is new. That's why they
your
call
honesty. Yes,
That's
I
what-
love that honesty.
So, and I think that comes across as not being paternalistic, that you should get this vaccine because I said so,
Right.
to I think it's the best thing for us, and these are the reasons why.
And these are the reasons why.
You know, ultimately, you will have to make up your own mind as to whether you want to get the vaccine. Different people have different motivations as to why they want to get vaccinated. But, you know, one thing that's kind of at its core is they want to make sure that they are also going to be safe.
Yes.
Now, keep in mind, there is a lot of noise out there
Yes,
that's been
there
generated
is.
by, you know, the unpopular press
Yes.
and by various fringe groups. And the issue is because there's so much noise, and unfortunately in the United States, scientific literacy is not, you know, always where it should be. People aren't sure what to believe.
Yes.
And so
that is correct.
one of the things that I'd like to do is to make sure that we are always available, even in the emergency department. Yeah, time is of the essence and people move kind of fast. But if someone asks a question, we should be able to give a reliable answer to that to try and help them figure out what they want to do.
One of the reluctancies I've been hearing from just asking around are people say they have allergic reactions to other things. How is getting the vaccine different from the other allergies that they may be presenting with?
That's a very good question. The issues with allergic reactions, let me just kind of dissect that just a little bit. Some of the vaccinations that have been given before, let's say flu,
The flu.
okay, are raised in or developed in like duck eggs, okay? And as a consequence, there are various particles, we call them antigens, that kind of trace along with them. And people can have reactions to that. Now, I have to make sure that people understand that there is a difference between an allergic reaction to something like that versus an immunogenic response, or that is the response that we want your body to have.
Correct.
Okay.
Yes.
Now, the key thing is an allergic reaction is your body's way of reacting in something it has not seen before.
Has not seen before. That is, yes.
And it really wants to build up an immunity, and you feel it. Okay? So the idea of this vaccine is you're giving the body, depending on, well, actually, regardless of the type of vaccine that you're giving, you're actually generating some virus particles that are not infectious, but that are being generated in your body so your body can see them. And when it sees them, and when I'm saying your body sees it, I mean it's your immune system
Your immune
sees
system.
it and says, this is not us. This is not Christy Arnold. This is not Kenneth Moore. Okay, therefore, I need to generate a response and fight this. And what people feel usually within the first 24, 48 hours or so after the vaccination is that immune response. They might have a low-grade fever. They might have a slight headache with it. They might have muscle aches with that. But that lets them know, hey, my body is actually doing something.
Yes,
It sees it and it's
yes,
reacting.
yes.
And yes, it is now going to be able to provide protection should I see the real thing.
The real thing. Thank
Yeah.
you for that, because that was going to lead to the next question that I
Mm-hmm.
was going to ask about the side effects that people are seeing after the second dose. So
Mm-hmm.
all those people, everybody out there, when you get your second dose and you want to know why do I feel this way, Dr. Moore just addressed that. That means it's doing it. That means your body's doing what it's supposed to do, y'all.
Good. Keep it real. Thank you very much. That's right.
Yes, thank you. So another misconception is with blood thinners. You know, someone has said, "I'm on blood thinners. I'm not supposed to receive the vaccine." Please explain why that is a misconception.
Yeah. Yeah, I have heard that. I've heard that also. It is, one, being on blood thinners is not a contraindication to getting the vaccine. Let's be very clear about that. Those people who are on Coumadin, those people who are on Xarelto, Eliquis, it doesn't matter. One of the things that may happen, and this is why some of the physicians have mentioned it, is because it isn't a site injection, you may have some more swelling, some bleeding in the area. Well, there are things that we can do supportively to try and minimize that. So that's not a reason not to get the vaccination. The other aspect of it is, and I wanted to make sure when I heard your question, is that people might confuse the issue of having heparin use with certain vaccinations. For example, in Europe, it was actually in the press, and they halted administration of the adenovirus or the AstraZeneca vaccination. Because they were seeing different clotting problems that were happening with people. And they were recommending, should you develop this type of issue, don't use heparin,
Right.
okay, or this type of blood thinner. And that makes sense, okay? However, in the United States, we don't use AstraZeneca, okay? And heparin is really something that is more case specific should somebody need to be admitted to the hospital. And so, yeah, so to summarize it, one of the things that you have to look at is risk and benefit, okay? The risk of just having some localized bleeding or maybe a little swelling from getting an injection versus contracting COVID-19,
right.
which could be moderately or severe, and the person could have a death sentence or could infect family members.
Yes. What are some contraindications to getting the COVID-19 vaccine?
Usually what they list is actually having an allergic reaction, a severe allergic reaction, and we're talking about swelling, difficulty breathing, blood pressure changes with any of the components of the vaccine. Now, for Pfizer Moderna, they're actually using a lipid emulsion or a fat droplet, okay, to contain the messenger RNA. Now, with that, that's what they're saying. If anybody has ever had that with their first vaccination, they recommend not getting the second one.
The second one,
Right.
okay.
But keep in mind that even if they've gotten the first one, that may impart about 70%, 70 to 75, almost 80% immunity to the person.
Wow, that is good
Yeah,
information
exactly.
to know.
So even if they've gotten one, guess what? It's better than not having gotten it at all.
Yes, yes,
Okay.
yes. Better than nothing at all.
Right.
Yes, yes. Let's see. Have you seen a lot of patients come back to the ED positive for COVID that have been vaccinated?
That's an interesting question. From my perspective, from the emergency department, I don't have a lot of data on who's been vaccinated and who's come back with disease or who's come back with complaints. It's more on what we call anecdotal. That is a person by person, what I've heard or what I've experienced. So I can't really give a global answer to that. But what I have seen is that there are very few people that come in that have said, I got the vaccination and now I have COVID. Now, keep in mind, the vaccination doesn't keep you from getting some symptoms.
That's right.
Okay,
That's exactly right.
Exactly. The vaccination, what it does is it helps your immune system fight it so you don't get severe disease. So you can come down with, cough, feeling, shivers. You might have a slight headache with it. If you are coming down with it, it's a sore throat. Okay. But then it doesn't progress. So then you don't have to worry about hospitalization. You don't have to worry about, low oxygen levels, that type of thing that really can turn the tide for a patient's outcome. So to answer your question, I don't have a good handle on the actual numbers on that. But just this is what I've been seeing.
All right. So in the fall, for those who haven't been vaccinated, do you think we're going to see an increase in the number of COVID positive patients in the fall? Do you think COVID-19 is going to be something like the flu, where we're in flu season or we're in COVID season?
Oh, that's a great question. I actually think we will be. We will be. As we see, and you can see it follow the pattern that we had last year that was established. You can almost predict as people got out and got around one another, we had a rise in
the number of cases.
Yeah.
We did.
And one of the things that I think President Biden and the medical community has been trying to do is get as many people vaccinated, the so-called 70% or herd immunity number, vaccinated, so we can actually blunt that response, so that we can continue to contain it.
Yes.
Now, the other issue that comes along with that is the issue of variants, that are actually circulating. Now, what that basically involves is that each time someone is infected, or the more people that become infected, there's more of a chance for the virus to do what it naturally does, mutate. So the more the virus can infect someone and be passed to someone else, the more there can be another variant. Okay. So far, the BK variant from England, the Brazilian variant, the South African variant, the vaccinations that we have are actually still fairly effective against them. It's not going to be the 95% level that we've expected with the Pfizer vaccine, or 94% with the Moderna. It may be 70%. With the other variants, but it still affords some protection.
It provides some protection, yes.
Exactly.
Yes. Something is better than nothing.
Something is better than nothing. And that's one of the other reasons why it's so important for people to consider get the vaccination, because then you actually reduce the risk of forming other variants.
Yes.
And so you can protect folks, because there's nothing more that, and I'll be personal about this, that I want to do, then get out and travel. Get out and, mingle.
Yes.
See folks.
Yes.
I enjoy jazz. I enjoy coffee shops. I enjoy traveling. I'd like to be able to get to it again.
Yes.
Okay?
Yes.
And so that's so important.
Yes, thank you so much. This has been a very, very good, informative session, Dr. Moore. Is
You're
there
welcome.
any more information you would like to provide to us today?
Actually, you've covered the waterfront with this, Christy. And one of the things that you mentioned at the outset that I think is very important, and I'd like to hear more about it, is the fact that you're offering vaccinations here.
Yes, so yes, every Tuesday here at Word Tabernacle Church, we're offering the COVID-19 vaccine from 8 a.m. to 11 a.m. and then again from 2 p.m. to 4 p.m. This is a partnership and collaboration we have with Nash UNC. This past Tuesday or yesterday, we had all three vaccines. We had Pfizer, Moderna, and Johnson & Johnson. So yes, we were able to vaccinate our individuals who were between the ages of 12 and 17. So no appointment necessary.
Awesome.
Just come to our wellness center. You can call the church at 252-442-2925 and ask, when is the vaccine, or what vaccine do we have, or can I come? Yes, you can come. Yes.
Oh, that's awesome.
Thank you again for this session, Dr. Moore. For another session of Wellness Wednesday, we will have our next session will be on July 7th at 1 o'clock. Again, we do Wellness Wednesdays every first Wednesdays of every month. And we look forward to our next session. Y'all have a blessed and wonderful afternoon. Bye-bye.
Thank you for having me.
You're welcome.
Goodbye.